Why are Kenyans protesting outside an Ebola quarantine centre? Has the virus now spread outside Africa? And should countries be tightening travel restrictions? These are the three key questions we're going to take you through as the Ebola crisis continues to unfold. The WHO declared the Ebola outbreak in the Democratic Republic of Congo a public health emergency. The organization's top doctor traveled to ground zero of the current outbreak this weekend to show support for the country.
This spreads very quickly. There are many factors that lead to that. I won't go into detail, but the fact that it doesn't kill as many people immediately like the other strains is of course, it's better for each patient, but is worse for the outbreak because it then spreads much quicker in the community.
But in Kenya, hundreds of people have been demonstrating. The protests come after US officials announced they were planning to send Americans exposed to Ebola while abroad to a new facility in Kenya instead of flying them home. The facility would be based at Laikipia Air Base, and it could be operational by Friday with 50 quarantine beds for patients. But the plans have faced pushback, not just on the ground, but legally too. Kenya's High Court suspended the facility and any arrival of foreigners with the virus. Kenya currently has no recorded Ebola cases, and the country's fragile health system was given as the reason why Ebola patients should not be allowed into the country. So a key question is, how easy is it for Ebola to spread outside Africa? Well, we can't say for sure. At the moment, there are only suspected cases being investigated. There are 2 in Brazil and 1 in Italy. Uganda has closed the border with DCR, and the US has imposed travel restrictions on travellers from DCR entering the country. Currently, the UK has no restrictions in place, but given the potential risk, should other countries also be tightening traveller restrictions?
So I think countries around the world are going to have to give careful thought to how they handle travellers from certain parts of Central Africa and their own citizens returning from those countries. We see the United States imposing on its own citizens a more intensive screening at the ports of entry. The UK situation is much more light touch. And of course, if somebody were to bring it into the UK and spread this to people they live with, then I think that the health authorities might have questions to answer.
There is some good news. DRC health authorities are celebrating after 5 patients who had Ebola have now fully recovered and have been allowed to leave hospital. But that doesn't mean to say the health crisis is anywhere near over, but it is a positive sign.